How much more should I expect to pay with the Motiva breast implant? Pricing of implants is, there's no specific price associated to really all of it. So it depends on the region, depends on the surgeon, depends on how many procedures they do with implants, over a year. The better prices typically you're gonna find with more of an experienced surgeon, a surgeon who does breast augmentation a lot. They're going to get a cheaper price, which means they're able to kind of offset that price point for you because of their volume. But you're also going to have to pay for their expertise because they do it so much and they're the best typically at what they do. So that kind of gets offset as far as the pricing of the implant. Really for the Motiva breast implant, I think you need to find a surgeon who's very well experienced in breast augmentation. I think the technique's going to be a little bit different. The typical making a space under the chest muscle and making this massive space is going to go away. With the Motiva implant, just the way the shell is made, because it has less interaction with the human body, and so it doesn't create a more significant scarring as far as the capsule of what we normally are used to with the smooth implants. And so the space controls will be much more important with the Motiva breast implant, as well as women who are thinner breasts and don't want a lot of volume and they just want a little more of that yoga, fit look. Now the new choice is going under the breast tissue, and so again, the dissection space should be probably a little more limited. It's not going to be a bigger space like we're consistently using with smooth wall implants. So you should expect to pay between 15 to maybe 20% more than a normal breast augmentation with this regular silicone breast implants for smooth wall. Again, you understand that the other implant manufacturers are all FDA approved. They're the best of the best in the world. You're going to get a great implant. It's going to give you great outcomes, very high satisfaction rate. But now we have a new implant that's kind of taking it to another level as far as engineering. The lowest risk of complication associated capsule contracture and rupture rate, and so there is going to be a premium. So I think that's fair. That increased price for the implant also comes with the surgical technique, so you need to understand you will pay a little more of a premium with the implant. So that's real talk right there for you. Hope you learned something. I love that question. Don't forget, like and subscribe, drop me a comment section below, and stay tuned for more.